For the past 20 years, we've partnered pretty closely with our local Family Services Collaborative on different grant projects in serving our community. So I contacted the administrator, Deb, and she suggested that we look at the local county health rankings for our community, which we did. We noticed that we had high levels of unemployment and poverty issues that we wanted to be able to address in our community. We looked at some more local resources that provided statistical information, and then we looked at anecdotal information. We looked at what people were telling us when they came to the CERC desk, what kind of questions they had of the library staff, and oftentimes that was related to jobs, employment, resumes, and so we knew there was a need that we could address. We decided that if we could help people reach their education goal and increase their opportunities to be employed or to be better employed, that we could help them to perhaps have access to health care or make better decisions about their health and reduce the disparities that maybe they were experiencing or the inequalities in access to health. So we really brainstormed. Deb and I got together. We would meet about potential ideas and potential partners and what we thought we could reasonably do to best meet those needs. So that's kind of the approach we took. We just brainstorm and throw it all out there and then try to assess what seems possible for our community.
When we talk about assessing, I always keep a close eye on our community, and it was big news when Steele County was #1 in the county health rankings for the state of Minnesota. But when I looked at it more closely, I could see that there were some things that weren't so great. The environmental factors that are part of those health rankings for your county, we were much farther down in the rankings there, and I thought, I think this is a place we can make a difference. I did call together our partners and I asked them to identify for me what the major issues were in health in Owatonna. And they really identified 3: obesity, depression, and the final one was oral health. We also talked a lot about health literacy, and I didn't realize really that this was an issue until I started doing some reading about it. I think it's more and more an issue now, understanding not just the information about different health conditions, but also understanding how to navigate the health system. When we started the program, I wanted local presenters. I wanted people to be able to see the faces from our local healthcare systems, to see them at the library, to see them in their workplace, to see them everywhere and understand that they are accessible.
I definitely think that you do need to look at some hard statistical data. You can't make up problems, and at the same time, don't ignore the things that you're hearing at work every day, because the two need to mesh together. They need to come together so that you can best serve the public.
One of the things I learned was to listen to our partners, but also to listen to our community. I sometimes had to listen several times before I heard what they were telling me. We need this, Mary Kay, and you know how to get it. Well, it took me a while, but I was able to pick up on those cues, and I urge other librarians to listen to your community and really listen to what they're telling you.